This is what we're going to do on the first session. Introduction to the modules. These key things, anatomical terms. So if you've not heard those before, we're going to go over those. What skeleton does, different types of bones, different parts of the skeleton, definitions of different parts of the body, different movements, that kind of thing. Once you've learned all those things, it then makes learning anatomy a lot easier. We teach you the skeleton first, because once you know the skeleton, the names of the muscles and the ligaments are often named after bits of the skeleton. So then that makes learning the muscles a bit easier too. Just going to talk a little bit about the history of anatomy, where it all came from, because things obviously have changed over the years. If you have a look here, it was started in 17th century, and they used to kill people, basically, or use prisoners to practice their anatomy on. So it's quite interesting. There's loads of anatomical museums in loads of different cities. London's no exception. We do quite a lot of cadaveric work in King's College, London, and we did some dissections there. Last time I did them in December. Okay, so there's quite a few around here as well. Where are we now? We're in Leicester. So yeah, there's Oxford and Kiel, Staffordshire way as well. So we've got a couple of anatomy labs around them too. Stuff started to get published 18th, 19th century. There was a shortage of cadavers for study, so they used to rob graves. So as soon as people were buried, then they used to dig up the graves and nick the bodies so that they could work on them. And it was quite lucrative as well, the people that would do it. Or they would, like I say, they would kill people just so they could use their bodies. So obviously it's a little bit different now, hopefully. You have to bequeath your body now to science and have to sign all the papers. And then when you do pass, your body is then checked over by the pathologist, usually a coroner, and then given to the labs. The bodies that I've worked on are mainly preserved in something called formaldehyde. So the tissue isn't quite the same as a normal living tissue, but they're changing the way they do it now. I was having a chat with someone just the other day, and they said that they're using different types of chemicals, so the tissue is more real, so it's more lifelike to work on. It's quite interesting because it feels different when they've had that. So people committed murders to get the cadavers, but then the Anatomy Act in 1832 stopped that in the UK. So we can no longer kill people.